I'm Dr. Najib Murr. I'm a neurologist and epilepsy specialist, and I work with North Oaks Neurology Clinic. Today we're going to be talking about epilepsy. Epilepsy is a brain disorder where you have tendency to generate seizures. So the next natural question is, what are seizures? Seizures are similar to electrical storms in the brain. Imagine an area of the brain that is dysfunctional, not working fine, and generating electric storms. Essentially, what these electric storms lead to is different clinical symptoms. The most commonly known types of seizures for people are the ones where you lose consciousness, stiffen up, and shake all over, but essentially there are other kinds of symptoms that people present with. The most common being altered awareness or loss of consciousness, staring off, not responding, not answering questions while still awake with eyes open. Of course, there are other manifestations too that belong to either vision changes, change in your sensation on one side or the other, change in your motor function on one side or the other, or even losing muscle tone and dropping down without even losing consciousness. Diagnosis of epilepsy begins in the clinic evaluation when we first see the patients by taking history from the patients and examining them. The second most important step is a video EEG monitoring. This is followed by a brain MRI, other kinds of imaging studies like PET scan if needed, neuropsychological evaluation because epilepsy is accompanied by other psychiatric problems like anxiety and depression, in addition to other more invasive and more detailed tests depending on what type of treatment we're going to adopt. Treatment of epilepsy starts essentially with medications. We're targeting seizure control with those medications. About 65% or 2/3 of the patients become seizure-free on a combination of 1, 2, or 3 anti-seizure medications. The second type of treatment would be epilepsy surgery for those patients who did not become seizure-free on medications. If surgery is not an option, then we move on with battery-like device or pacemaker-like device that is implanted either under the skin or in the head to control the seizures and lower the numbers of seizures. Believe it or not, we have lots of research going on to help all the patients with epilepsy deal with their ailments. In addition to medications, surgery, and devices, a lot of clinical trials are ongoing to identify better medical treatment and better surgical and device options for epilepsy patients. Don't let epilepsy control your life. If you're struggling with it, do not hesitate to reach out to an epilepsy specialist like myself.